soul rest in peace. And he educated us a lot about physiotherapy. I got interested and got on the course.
The rest is history.
The rest is history.
All righty. If you have any questions around back pain and physiotherapy, posture, let us know. Send us give us a call, 054-366-4264. What are the most common complaints that come to your practice with respect to physiotherapy? Okay,
with physiotherapy, we handle a myriad of conditions in medicine. The most common is stroke, and then the most common amongst the middle age group is the low back pain, the neck pain. These are the predominant issues that we get in our clinics. Okay. And it runs through all clinics within physiotherapy in Ghana. Yeah.
So stroke is number one?
Stroke is number one.
What are the age ranges you are seeing for stroke?
The age range for stroke, I would say from our late 40s all the way to 60s. Yes, we get a lot of people coming with stroke.
Distribution between females and males, what I get?
It's more predominant in the males than the females.
Why do you think that's so?
I would say, stroke has a myriad of risk factors that bring about the condition. And our men, they go through a lot of stress. There's the issue of smoking, which can also cause it. There's an issue of drinking. There's an issue of lifestyle, not taking care of yourself very well. Hypertension, diabetes, these are all causative risk factors that can result in stroke.
Okay. Hey, let's not make it just a two-way conversation between me and Dorothy. You can give us a call as well, 054-366-4264. Any questions to do with rehabilitation after a stroke, issues of back pain, Dorothy will give you the advice. I understand that when a person gets a stroke, it's the speed to get to people like you is important.
Yes.
You have to get there quickly.
Exactly. Stroke, when somebody develops a stroke, how you respond to the person is very crucial to the recovery. Because once the person is attended to early, we are likely to get better recovery out of the person. So it's important after all your BPs, your sugars have all been stabilized by the doctor, you get to a physiotherapist to start with your rehabilitation.
We also hear from sports people. We hear about the sports person has gotten injuries. He's going to see the physio. What kind of sports injuries?
We see a lot of sports injuries like anterior cruciate ligament injuries.
Break it down
of the knee.
Who is that? What is that?
It's the ligaments that are holding it.
Here?
Exactly.
Here?
Yes.
Okay.
The anterior means what I see, the front side.
Okay.
That's the anterior. We have a lot of ligaments within the knee.
Okay.
So when somebody moves or goes through an activity and then tears it, it could be a partial tear, it could be a complete tear. When there's a complete tear, you would need surgery. But with some partial tears, you would need conservative treatments as physiotherapy to get you on. But it would go through a certain period of time.
Okay. So and these are footballers?
These are not footballers alone. There are people who are not even footballers. They also incur such injuries and they see the physiotherapist for help.
Okay, you're watching GTV Breakfast. We're looking at physiotherapy, and you can join the conversation. 054-366-4264. Consultant physiotherapist Dorothy Asamoah is here with all the information that you need. So, how do you measure and monitor a patient's improvement when they come to see you and they start their whole journey back to recovery?
Okay, so the very predominant skill which we use, we have different skills that we use when we are doing our assessments. Let's say somebody comes with a stroke and has one part of the body paralyzed. We go through a certain skill. We have we call it muscle power grading skill, where we grade your muscle depending on how you are able to move against gravity. So we grade it and give it a certain number. So as you go through therapy, we keep reviewing to see whether we've gotten some improvement in the muscle power. And once we get an improvement, the power would increase than what we recorded earlier. And we also have a skill where we assess your pain level. They call it the visual analog scale. It's a VAS skill. So it's up to 10, 0 to 10. When your pain is very much, it is 10. That's pain is so much that you can't do anything. So as the pain goes down, the number on the scale also goes down. So that's how we are able to monitor how well our patients are doing with our therapies.
How can we find you?
Physio Solutions. I am with Physio Solutions.
Yes.
We are in East Legon, 13 Sergeant Ajete Street. Our closest landmark is the Shares Afrique Park.
Indeed.
That's Kwame Despite's house. That's where we are, just behind his house. You would locate us there. And we don't just do physiotherapy alone. We have incorporated all rehab services. So we have speech therapy, we have occupational therapy, we have respiratory therapy, we have psychotherapy, we have diet therapy as well.
Okay.
For anybody who needs any of these services, we provide it.
And
there's one interesting thing that we do.
Yes, briefly.
We have an inpatient rehabilitation.
Okay.
That's where somebody incurs an injury, goes through the hospital, and then is recovering. We bring those people in to stay in our facility.
Okay.
And we take them through vigorous therapy to get them well and then discharge them back to their homes.
Almost like a hotel hospital.
Exactly.
Okay. All right.
Exactly.
And if I Google Physio Solutions, I'll find you.
You would find everything. You find us on Facebook. You find us on Instagram. We are on Twitter. We are on TikTok. We are on every social media platform.
We are carrot.
Dorothy
Asawa, our consultant physiotherapist, giving you a sneak peek into what it takes to get the correct care as far as physiotherapy is concerned. Look for Physio Solutions and Rehabilitation.
Yes,
right there on Google, and you will find them. Thank you for this cute conversation.
Thank you too.
Have a pinky day.
Thank you.
All right, coming up, we have social media corner headlines. We've got for you the return of Neo Date Lamptey. We've got conversations on Green Ghana. We've got We'll learn the words. But Thelma is here, and she's got the sports for you. Stick around. Do not